but don't break
Hi, everyone. This is Dr. Tammy Patzer, Optimal Health, and we are sponsored by Relief Now Laser Methods. And today I have the privilege of speaking with Dr. Jeff Shebovsky.
it. Yeah, you
And
got it.
he is in the Orlando area or the Orange County area of Florida. So most people are very familiar with that part of Florida. And we're going to be talking about laser methods. But first, let me just tell you a little bit about Dr. Jeff. He has a very diverse wellness background, and he's been in practice for more than 28 years. So let's just say he probably knows a little bit about wellness. So let me just tell you a little bit more about Dr. Jeff. First of all, it's really exciting because he has a forthcoming book called The Laser Solution: How Class 4 Deep Tissue Laser Therapy Can Save You from Drugs, Surgery, and Side Effects. And that is something that's really important. And he actually is the president of the Central Florida Chiropractic Society. And of course, he is a doctor of chiropractic, and he also has a bachelor's degree in science. And he went to the New York Chiropractic College. So he has a very diverse background. And of course, he was also on the dean's list for uh, the International Chiropractic Honor Society Phi Chi Omega. So that's just a little bit about his, let's say, educational background. And he is married, and he has his wife, Carol, and their children are Brooke, Erica, and Jason.
All
And one
right.
of the things that I thought was kind of cool about you, because I had this little vision, was you actually worked with the Orlando Solar Bears professional hockey team. And
Mhm.
of course, I saw these in my mind. I saw the little solar bears, of course, they were little polar bears, but they were
The
solar.
polar bear with sunglasses.
So that I thought was really
Nice
cool.
logo. Yeah. Nice
So
mascot.
another thing that we have a lot in common about is you're actually a former radio show host, and you had a show on Sundays called Back to Wellness with Dr. Jeff. So I've just given this kind of a broad image of who you are. So tell me a little bit more about your background and how you came to really focus on laser methods now.
Yeah, it's interesting story. Thank you for the wonderful introduction, by the way. I got out of chiropractic school. I moved down to Florida, settled in Orlando, almost 30 years ago now. Opened my practice in 1994. And I was just, doing regular chiropractic care. We were getting great results with chiropractic, as a lot of chiropractors do. And we slowly started to add therapies over the years. And I've tried every therapy imaginable at this point and we still have a lot of spinal decompression therapy, ultrasound, electric muscle stimulation, physical therapy, traction tables. We've done everything, including years ago. I was one of the first ones to adopt class 3B laser, which is low level laser. The difference is there's 4 levels of laser. And what happened is about a year and a half ago, I dislocated my elbow playing baseball. I'm in a men's baseball league, and I went for a ball and I took a tumble and my elbow popped out of place. It was a horrific, worst injury I've ever had, worst pain. I had to be taken by ambulance to the ER and get my elbow reset. And I'm like, okay, now I can't treat people. And the orthopedist said I wouldn't treat for 3 months at least. I'm like, I can't wait 3 months to treat people. I got to find a way to do this quicker. So I was interested in class 4 laser already, and I had other people I knew that were kind of using it and telling me about some of the results. But I was still on the 3B laser, the low powered, whereas class 4 is high powered laser, deep tissue. So I said, all right, I'm going to buy a laser and try myself first. And if I get results, then I'll roll it out to family, friends, staff, and then finally patients. I like to test everything I do first on, the people that I know. So I did my own laser. And within 6 weeks, I started to do chiropractic adjustments again, where they told me it would be 12 weeks before I could do that. When I went back to the orthopedist, he's like, "What are you doing? How are you healing so quick?" And I said, "Class 4 laser therapy." And he was literally the shock on his face that because he sees a lot of these injuries and no one gets better to that point in 6 weeks. So, I still had more rehab to go, but I was actually doing stuff in 6 weeks that was unbelievable. And I started doing it on family members and tracking their progress. They were all getting great results with all different conditions. Tried staff members, and then finally brought it into the office and started doing patients. This is about a year and a half ago. It was about May, a little less than that actually. It was about April or May of 2021. And so laser came about, class 4 laser came about as my just getting good results for myself and then bringing it out to the patients.
So I like the fact that you said that you tried it on yourself, and I think that is the best recommendation of anything that we ever do, is that if we can honestly say, hey, I hurt myself and I did
Exactly.
this, and now, it's helped me. So since you've been in the business of helping patients with wellness now for nearly 30 years, when you have offered this to your patients now, what types of ailments are you treating with these lasers now? What can you treat with class 4 laser?
That's a funny, not a funny question, a good question. It's funny because it's virtually unlimited. I think I heard another physician say there's 3,000 conditions programmed into his machine that they can treat. Obviously, we don't treat 3,000 conditions, but it is literally, I mean, from the musculoskeletal side of things, almost anything: carpal tunnel syndrome, tennis elbow, shoulder tendonitis, shoulder tears in the tendons in the rotator cuff, neck pain, pinched nerves, back pain, sciatica, plantar fasciitis does wonderful, very tough condition to treat. Knee problems, knee arthritis, hip arthritis, tendonitis, pulled hamstring muscles, it's herniated discs. And really exciting for me also is now neuropathy, where most of these patients don't even get treatment, and we have something to treat them with. We've had now several cases of neuropathy, and they're all responding well. One was due to chemotherapy, one was due to diabetes, one was just due to aging, and the nerves don't work, and they're getting pain and numbness and tingling and can't feel their feet or their hands. And we're getting results with these people with laser. We put a few more items in the treatment basket, so to speak, along with the laser, but laser is the main thing that is getting these people better. So yeah, you could treat skin conditions with it, eczema and things like that. There's all types of settings on the laser that you can adjust to treat different conditions. Very
So,
exciting, very exciting.
so it
Yeah.
sounds like you just need to talk to you to find out, like, if you have something that needs to be done. Like, every time I hear about the lasers, because I have knee pain
Yeah.
and hip pain, and I was told I have arthritis. So I perk up to go, okay, there is something that I can do beyond, rubbing the cream into my knee or other things, because um, I know one of the things that you're really about is how to, ditch the drugs, skip the scalpel, to
Yep, that's
make
our little
sure
mantra, a little
that we're
saying.
not getting into drugs and surgery, unneeded surgery, because I think that's really important, because I don't know anyone who, says, oh yeah, just give me pills,
Right.
when there are ways to actually heal. So can you explain a little bit more about how this class 4 laser, what is it actually doing to help to heal all of these different things?
Yeah, well, so laser uses a laser light, so it picks for red beams of light that will penetrate the tissue. Due to the class 4 laser, the power is high enough to penetrate deep into the tissues. One of the problems with the class 3B laser, the previous generation of low level, is it doesn't have the power range to penetrate deeper tissues. But on the basis of physiology, on the basis of how the cells work, the cells pick up the light and they react to it. And the basis of it, in the easiest way to explain it, is it increases or accelerates tissue repair and healing. If you're trying to heal and your body's having trouble, this will greatly speed it up, tremendously speed it up. It'll help it to heal. So tissue repair and healing is increased. Inflammation is driven out of the cells. The blood vessels are open, so you get good circulation to promote more healing. There's an very strong analgesic or pain relieving effect, so you can relieve pain quite substantially, quite quickly with the laser. And then there's increased metabolism. Basically, the cells just turn over and they get rid of waste products. So if you're holding on to waste products, cells have to metabolize and they have waste products. So that's part of the getting rid of the inflammation, getting rid of waste products, inflammation, and then controlling pain, opening blood vessels, and accelerate healing. It's truly a remarkable therapy. It really, really is.
It does sound remarkable because of all the things. And I know there's about 19, not 19, 900 different studies, medical studies that are backing up all of the things that you're saying. When people, how long does it typically take? I know it probably depends on what is going on, but if somebody comes in to see you, how long is the office visit, for example, but how long would it take for them to see some type of a result like, oh my God, it doesn't hurt anymore?
Right.
Or how long does that take?
It's funny. Everybody's different, obviously, but what we do is we put a 6 visit baseline on everybody. We say, do this for 6 visits, 3 times a week for 2 weeks. Don't mess around with the schedule. Like, keep your visits and let's see where we're at in 2 weeks. And it is incredible on how many people are remarkably, if not totally better in 6 weeks. And as far as the length of each treatment, it's about, it can be as little as 5 or 3 minutes on a small part, depending, up to about 8 or 10 or 15 minutes. So it really depends. So I'd say take it from, say, 5 minutes to 15 minutes is treatment time range. Depends on the power and the intensity and how much energy we have to impart into the tissues. As far as feeling better, I have people literally, the other day, it just happened twice again. The lady got up, it was a plantar fasciitis for foot. She got up and started walking, and she had this strange, surprised look on her face. I said, "Are you okay?" She says, "No, I don't feel it like I usually do. Is this possible it works that fast?" And I said, "Absolutely." And we see that. We had the one the other day with, it was a neuropathy patient, and she has trouble feeling her feet on the floor. So she loses balance a lot because you can't feel yourself walking on the floor. You tend to lose balance. And she walked from the laser room to the regular treatment room and said, "I feel better already." One session. So this happens a lot. It's not every single patient, but certainly by 2 or 3 or 4 sessions, almost like a light bulb goes off on a lot of people and they go, "Wait a second, did you change something last visit? Because I feel a lot better now all of a sudden." And I said, "No, that's the cumulative effect of the laser. Every time you do it, it's increasing the healing a little bit more." So, within the 6, we judge it. And we know that most people are already doing better, if not fully better.
So I know that your offices are located in the Orlando area, but do you have patients who come from out of the area, out of the state, or out of the country?
It's happening more. We've had several people now from out of the state, a couple out of the country, actually, South America in particular. And we have on the website now where there's, if you're traveling to see us, call us first. We'll help you with travel arrangements, hotel and whatnot, because we're getting more and more of that. It is a unique type of service. Not a lot of doctors are doing it, and it's cutting edge, but the results people are seeking out because they're hearing more and more about these results. And it's what could be better: non-invasive, non-drug, non-surgical, non-injection. I mean, it just helps your body heal. It's a natural approach, and people want that more than ever.
So I want to ask you a little bit more about your book that's coming out, The Laser Solution: How Class 4 Deep Tissue Laser Therapy Can Save You from Drugs, Surgery, and Side Effects. So what is the content of that book? And do you have any idea when it'll actually be published?
As far as publishing, it's in the works. It might be a couple more months. They're getting it done. I hear there's a paper shortage amongst everything else with supply chain issues. So it's putting it back, probably looking toward end of October or November. But what it is basically a laser solution. Like, people want to know, there's an opioid crisis going on. It's out of control right now. And people don't want to be on pain mesh, and they don't want to get surgery if they can avoid it. They don't want to be injected with dangerous drugs. So this book talks about the history of laser, what the physics of laser, a little science, and the many conditions that we're able to treat, and the successes we have with it, and why it works and how it works. It's kind of like a big expansion on what I just told you here, but breaking everything down into smaller parts so people can understand it in more depth if they'd like to.
So that way they get to be educated and
Very much
understand
so. Very much
exactly
so.
how it works.
Hmm.
So if
Definitely.
somebody wants to reach out to you, what would you say is the best way to do that?
Well, we have three locations in Orlando area. We have a phone number at 407-871-6267. And that's our main number that can connect to all three offices. And then we have the website, which is, of course, www. I don't know if you have to do that now anymore. And it's reliefnowlaserorlando.com. So reliefnowlaserorlando.com.
It's interesting because when you think about it, relief now makes it sound like it's happening now. So the fact that you said that so many of your patients have literally gotten up and said, "Oh, I
Yeah.
I feel better," because it's so funny with pain. You get so used to having pain, and then when you don't have it, it
And
literally, you
it's
said that.
hard to believe it can occur now, but it can. And now can be right then. It could be within the first 2 weeks. But I tell you, the 6 visit baseline is really nice because it tells us if you're going to respond to laser within that time frame. Given, except for maybe a couple conditions like neuropathy, which is more challenging. That right from the outset they're going to need more. But almost everyone else, within 6 visits, we can tell. And so we don't waste your time or your money. Like if you're not better at all in 6 visits, we're not going to continue. I'm not going to say come for 4 months and we'll see if it works, right? Who wants to do that and who wants to spend that kind of money? So it's a small out of pocket and a small bit of time of your life to try it for 2 weeks, 10 minutes or so each time on average, and see if it helps. And we gauge it at that point. If you're 25% better, well, that's okay. It's only 2 weeks. It's a chronic condition, but you're getting better. 50%, 75%, 90%, based on what your input is to us after those first 2 weeks, we'll make additional recommendations, but some more than others, depending on your level of improvement.
So, is there anyone who should not consider laser therapy?
I mean, there's certain people like cancer patients. We're not going to do it over an active area of cancer anywhere in that area because cancer cells are very active and we don't want to activate them more because it is stimulatory, the energy that we put in to the cells. Would be best in those people, even if we're doing on a remote area, like let's say you have breast cancer, we're doing your knee. Technically, shouldn't affect that area, but let's get approval from your oncologist first. So we're very, very cautious with people's health with that type of stuff. Pregnant women, not over the abdomen or anywhere in that area. Those are the two of the type of active infection over an area that's infecting the joint or the bone. Obviously, would be something, but there's not a lot of conditions that you can't do it on and that won't respond.
So it sounds to me like you basically can work with the other medical professionals that a patient might have working with them so that they're going to get that best overall care for the whole human and not just for some ailment that they might have.
Absolutely, yeah. We work. We're very big on the integrative approach. It's like my practices have a medical physician, a physical therapist, a nurse practitioner already on board. But if you come in and you have your physician, and we want to clear stuff with your personal physician or your oncologist in the case of cancer. But yeah, we're big on the integrative approach. That's why I've added that to my practice years ago, and it's really nice to have everybody on the same team communicating on the person's health.
Wow. Well, is there anything that I forgot to ask you? I know that you have a background with sports injuries, whiplash, brain injuries, and things like that. So obviously, you, again, like I said when I was introducing you, you have such a phenomenal background, supporting everything you do. And I know you also speak all around to educate people and other professionals about laser and chiropractic and other medical conditions. So is there anything that I may have forgotten to ask you?
I think you covered most of it. I mean, it's just I would love people to really investigate this type of treatment, this laser, because it is I've never, I think I said it before, but I'll say it again if I haven't. I've never in my 28 years, 28 years in my own practice, 30 years in practice, I've never seen anything work as quickly and as efficiently and as effectively as this therapy does. And I do want to point out to people, there is one thing. People hear laser, they think of a surgeon cutting through tissue and burning, cauterizing tissue during the surgery. That's not what this is. This is in the same class of surgical laser power-wise, but it's a diffused beam. So when it doesn't go in like a scalpel, it goes in therapeutically to heal the cells. It's a diffused beam. So it feels warm and pleasant to have done. Like people feel this nice warmth and it's very soothing and relaxing. The only danger is to the eyes for the most part. You have to wear special eye protection, which we give to everybody in the room, the person that's performing it, and then the patient. And if there's a patient spouse in the room or something, everybody has to have laser goggles on. But it is just an amazing therapy, and there's basically no side effects. It's going to work or not work, and we'll know that in 6 visits. It's like very little to lose, a little bit of time and maybe a little bit of money, you're spending to do it. But it is just life-changing for people, and I want people to really, really investigate this this therapy, because it literally can change you and avoid surgery big time, and drugs.
Yeah, ditch the drugs, skip the scalpel. I
Ditch
mean,
the drugs and skip the scalpel. I love that
perfect sense.
that line. It's great.
Okay, well, great. So again, let's remind everybody how they can reach out to you for a consultation.
Yeah, there's 2 ways. The easiest way is probably to go onto the website, Relief Now Laser Orlando.com. And there is the phone number 407-871-6267.
ReliefNowLaserOrlando.com. Well, thank you so much, Dr. Jeff. I really appreciate all the time
You're
you spent
welcome.
with me
I thank
today.
you for having me on the show. I really appreciate it.
Thank you.
All right.
So everyone, this is Dr. Tammy Patzer, and this is Optimal Health, sponsored by Relief Now Laser Methods.